Hello, if you're waking up several times per night to urinate, you may have sleep apnea, a potentially deadly sleep disorder. I'm Michael, a dedicated researcher in the field of sleep apnea. Today, I want to share some fascinating insights about the connection between sleep apnea and an overactive bladder. Sleep apnea is a condition where your breathing repeatedly stops and starts during sleep. This happens because the muscles in your throat relax too much, blocking your airway. As a result, you might snore, gasp for air, and experience disrupted sleep, leaving you tired during the day. On the other hand, an overactive bladder means you frequently feel a sudden, strong urge to urinate, even when your bladder isn't full. This can lead to frequent bathroom trips and sometimes accidental leaks. Researchers have discovered that these two conditions are connected. When you have sleep apnea, your body briefly wakes up to restart breathing. These awakenings can cause your bladder muscles to contract, making you feel the need to urinate. Interestingly, it works both ways. If you have an overactive bladder, it can disturb your sleep, which in turn can worsen sleep apnea symptoms. This creates a cycle where each condition aggravates the other. The good news is that treating sleep apnea with a continuous positive airway pressure, CPAP machine, can help. CPAP keeps your airway open, improving sleep quality and reducing nighttime trips to the bathroom. In summary, sleep apnea and an overactive bladder are interconnected, and managing both conditions can lead to better sleep and an improved quality of life. Now, to dive deeper into this topic, I'd like to introduce Dr. Raina Malik, who will explain in a video how overactive bladder and sleep apnea are linked.
Do you snore really loudly at night? And are you also waking up multiple times to urinate? Well, guess what? They might be more related than you ever thought. I'm Dr. Raina Malik, urologist and pelvic surgeon, and today we're going to talk about how a condition called obstructive sleep apnea can impact your bladder function. Now, studies have shown that sleep apnea can also have an impact on bladder function, particularly waking up at night to urinate frequently. Now, one of the prevailing theories as to why this happens is that when there is a blockage or obstruction in the airways during sleep, it creates a negative pressure in the chest and it makes the body work harder to breathe. So now the body's working harder and it sends a signal to the heart that there's too much fluid in the body. In response, the body says, hey, I'm going to release some different signals called atrial natriuretic peptide, and it also inhibits the secretion of antidiuretic hormone and aldosterone, which can lead to increased urine production and ultimately the need to wake up more often at night to empty your bladder. So the disease state itself also causes reduced oxygenation throughout the night because you're not breathing for a certain period throughout the night. And this can actually prevent the reabsorption of sodium in the kidney, meaning there's more sodium in the urine, which causes more water to be drawn into the urine, making more urine volume. Now, waking up at night to urinate might just seem like a huge bother, but in reality, it's a serious problem. That's because we know that particularly in older patients who wake up 2 or more times at night, there is a significantly higher risk of falls and hip fractures. And that is not a small issue. I've seen so many patients in the hospital after a fall, and they're there for long periods of time, and it takes them a long time to recover. So even though the nighttime urination is a problem, there's also been some small studies that suggest, particularly with severe sleep apnea, they can also affect daytime symptoms, meaning that you'll have more urgency incontinence, and more frequency, meaning you're going to the bathroom more often and you're getting this urge to go that you can't delay. Now, here's the kicker. Treating your obstructive sleep apnea with a CPAP machine or a machine you wear at night that helps reduce those episodes where you reduce your breathing can significantly improve your urinary symptoms. And it does this by decreasing the amount of urine production overnight. And that makes sense because the hormonal changes that would normally cause you to make more urine are getting reversed, allowing your body to concentrate urine better overnight and then reduce the amount you're making and wake up less. So if you've got symptoms of sleep apnea and you're waking up at night to urinate, don't wait. Go see your doctor right away, get evaluated, because not only might you improve your quality of life in terms of sleeping at night with better sleep, but you might also improve your overall health so you're at a lower risk of things like heart disease and high blood pressure.
Thanks, Dr. Malik. You can find Dr. Malik's videos on YouTube. And you can also find more information about sleep apnea at sleepwelliq.com.